got into medicine because I wanted to help people. And you can help people in many different ways, but the whole issue with oncology was that it was always moving. The field is always advancing, and so we've seen this in the past couple of years. It used to be that oncologists gave very basic chemotherapies and some pills to help patients fight their cancer. Now we've expanded to even more things like other different oral therapies, immunotherapies. We've even had, vaccines that have been developed, and they continue to develop all these new therapies, and it's very exciting. So the fear of chemotherapy is definitely a real fear, but it's nice that you have all these options available. When I talk to my patients about immunotherapies, chemotherapies, what I like to tell them is it's like unlocking a door. There are all these different keys that we can use, and the combinations of these keys to help open the door and get rid of the cancer. And so that's partly how immunotherapy works, is we have these different keys and we're inserting them into the lock and hopefully freeing them up from this cancer. The amazing thing about immunotherapy, and patients really are very receptive to this, it's using medications, using your body's ability to fight cancer, and a lot of these immunotherapies are better tolerated than the traditional chemotherapies that we've had before. So we have these options that if it's appropriate, we can offer patients these new and probably better options rather than the traditional standard of care. One of the advancements over the past few years is we've learned more and more cancers have unique signatures. And we test for all these signatures as to better personalize the therapies that they can receive. Sometimes these signatures mean that certain therapies we have will not work. Therefore, we're not wasting anybody's time giving people these therapies, and we're not subjecting them to unnecessary side effects. So by being able to test for these molecular signatures, we can better pinpoint and target the best target for a patient's cancer care. It's nice that here in Largo we have a cancer center that provides the radiation therapy, the imaging, the consistency of seeing the same people and over and going to the same place to get their care. It's really fantastic. And Florida Cancer Specialists also has all these services that they can provide, and we can control the quality of the analysis, the thoroughness of the analysis, because this is what we do every day. I am constantly humbled by patients' trust when you have taken care of other family members, friends, and sometimes the outcome is not what you want for patients. And I'm always, again, humbled that when they have an issue, that they trust us and they come back because they trust in you, and it's incredibly humbling.